Good morning to one and all. I'm Dr. Priyanka, and today's topic is tooth preparation for full veneer porcelain fused to metal, that is the PFM restorations or crowns. So, coming to the learning objectives, there are three learning objectives. So, firstly, you have to list the indication and contraindication of the PFM crowns, advantages and disadvantages of the PFM crown, and we have to elaborate step by step procedure of the interior and the posterior of the preparation. Okay. Coming to the advantages and the disadvantages. So, advantages is that it has high strength with good aesthetics, right? It is less expensive than all ceramic crowns. It does serve as a good retentive crown. It permits easy corrections of axial walls, right? So during preparation, you can easily contour the axial walls as there's sufficient space. A disadvantage is that, of course, the aesthetic is not perfect. Sometimes the color matching is a problem because of the metal shade in the underlying structure. Um, Metallic margins sometimes are visible, yeah, which is not very aesthetic for the patient. Translucency is a little bit reduced because, yes, you can do porcelain layering on top of the metal restoration, but there's the shade always almost doesn't come through very perfect all the time. Okay, ions may discolor the porcelain. Yeah, so there can be a little bit discoloration which can be present. Porcelain may fracture, and then the metal will be exposed. Right? Okay. Coming to the indication, the contraindication. Um, so yes, teeth that require complete coverage are indicated here. Aesthetically, if you want to correct it, yes. If the patient is not agreeing for any other restoration, this is the way to go. Extensive tooth destruction, which results from caries or trauma, can be corrected. Endodontically treated teeth can be corrected here. They're not corrected, guys. It can be treated. We have to restore the endodontically treated teeth with a cover, yeah, with the crown. Sorry. Um, for proper occlusion and for the proper support, right? For the proper functioning, right? Also, the need of recontouring axial surfaces and can be, used for correction of slight malocclusions, guys. So in the way we prepare, we can correct the angulations of the teeth at a slight degree, not too much. And if all ceramic crowns are contraindicated, right? Okay. Coming to the contraindications, so if there's active caries, this is not indicated. In untreated periodontal diseases, this is not advisable. In young patients with large shambles, not advisable. High risk of pulp exposure, again, not advisable. Objectives met with more conservative preparation, that is the composite resin or porcelain laminate veneers, right? Okay. So for such cases, no, it's not indicated, guys. Right. Okay. So coming to porcelain fused metal crowns, also known as a metal ceramic crown, consists of a ceramic layer bonded to a thin cast metal coping that fits over the tooth. Preparation, it combines the strength and the accurate fit of a cast metal crown with the cosmetic effect of a ceramic crown, right? It has a greater longevity. Yeah. Okay. So coming to the anterior preparations, guys. The armamentarium is you need a lab knife with the blade, silicone putty, an accelerator, handpiece. So that is for the putty index, guys. Yeah. Okay. Um, yeah. Sorry. Flat and tapered diamond burr, small wheel diamond burr, long needle diamond burr, torpedo burr, and radial fissure burr. Okay, steps. So these are just the outlines, and then we'll go in detail. So first, we make depth orientation grooves. We do the incisal reduction, then we go through the labial reduction, then the lingual reduction, then the initial proximal reduction, then the lingual axial reduction, then the axial finishing, and then the axial and shoulder finishing. Okay. placement of deep orientation grooves on labial and incisal surfaces. Okay, so first you can see that on the incisal surfaces, on the labial surfaces. So why do we have two orientation grooves? Because it is angulated in two dimension, right? In two planes, sorry guys, right? The central incisor is not straight. It has one angulation from middle to the gingival third, and from middle to the incisal third is another angulation, right? Okay, so using a flat and tapered diamond burr, the grooves can be made, right? And then you have to, you can use the full diameter burr for it to sunk in and then reduce the uncut surface of the teeth, right? So you'll get that depth groove indentation done. The labial grooves should be cut in two sets, parallel to the gingival half and the labial surface, and incisal half to the labial surface, right? So these are 1.2 mm deep. The incisal grooves cut on the incisal should be 2 mm. Okay, it should extend gingivally. All right. To achieve adequate reduction without encroaching the pulp, facial surface is prepared into two planes, like I already mentioned. Um, so there are two planes. We cannot over contour, guys, right? And if we taper too much, we will cause exposure of the pulp. So these two planes have to be preserved, in short. Okay, so you can see the two plane reduction here, guys. Okay, so in the A it says if only one plane is produced, that is what happens, right? In the second one, if over contour happens, you are kind of exposing the pulp, right? You're encroaching the pulp. Or D is already kind of encroached the pulp, guys, right? Okay? Sorry, D here, okay? So that's why we have to stay away from the pulp, right? Okay? So you have to basically follow a two-plane reduction, all right? Okay. Right? So here and here, sorry, guys. Okay, now coming to the incisal reduction. Okay, so when we oriented the depth grooves, now by flat and tapered burr, you can just cut down the incisal edge, guys. Okay, so then first to allow easy instrument access to the axial surface and gingival finishing line. Okay, inadequate reduction will cause poor incisal translucency with finish restoration, right? Coming to the labial reduction incisal portion, using flat and tapered diamond burr, yeah, all tooth structure uh, planed off to the depth of the depth orientation groove, right? So you're supposed to merge the inside the labial portion properly, right? Okay, the gingival portion. Here you can see by using a flat and tapered diamond burr as well, you can merge the orientation grooves. Reduction can be carried out around labioproximal line angles to a 0.1 mm lingual to proximal contacts, right? Okay, so meaning keeping the margin there, right? Intact, you can contour the gingival and the labial portion, yeah? Okay. And now coming to the lingual portion, guys. Um, yes, a small veal diamond burr, yeah, can be used. So around 0.7 mm clearance with the opposing teeth should be there. Those portion of the lingual surface which will bear the ceramic veneer should be, or the restoration should be at least having 1 mm clearance, okay? So junction between the cingulum and the lingual wall should not be over reduced, right? It may affect the retention, guys, okay? Coming to the incisal proximal reduction, guys. So first we will do the initial proximal reduction, right? So you will be using a long needle diamond burr, right? And there will be complete access through the proximal areas to minimize the chances of nicking of the adjacent tooth. So yes, you create the with the needle burr, you just create a little bit ledge of enamel, and then you break the contact by the probe, like I taught you. Okay. Lingual axial reduction using a torpedo diamond burr, reduce the lingual axial and also some portion of the lingual surface, right? Okay. Lingual and axial finishing using a torpedo burr. Um, it can accentuate the chamfer finishing line on the lingual and on the proximal surface. So, but yes, here we are just following shoulder all over, guys, right? So or you can also follow chamfer where you're giving a metal portion and on the porcelain or ceramic portion only the shoulder. But here we're just telling you to follow all shoulder margins, right? Okay. Posterior proximal, proximal, posterior porcelain fused metal crown. Okay, so they all remain the same. Okay, steps here are the occlusal reduction, the functional cusp bevel, facial reduction, proximal axial reduction, lingual reduction, finishing, and facial reduction. And okay, okay. Coming to the occlusal reduction, guys. So ideally, first we are supposed to reduce the occlusal. That is 1.5 mm clearance in the functional cusp. For the maxilla, it's the palatal cusp. For the mandibular, it is the buccal cusp. So that is the functional cusp. For the opposite non-functional cusp, you can do 1 mm reduction. Depth orientation grooves have to be placed on all the surfaces by round and tapered diamond, guys. Okay. Round and tapered diamond is used to place the grooves on the ridge and primary grooves on the occlusal surface, right? So you can place some grooves on the ridges, and the other grooves can be placed on the occlusal surfaces. Okay, so it will help you merge it well, guys, like we have discussed even earlier. Yeah. If there is already some clearance with the opposing teeth because of mal position, groove should not be placed very deep, guys. Okay, right? Because of super eruption or any other thing. So then you have to be careful. Okay, the occlusal reduction should follow the configuration of the geometric inclines that are made from the occlusal surface of any posterior teeth, right? So all the anatomy, the planes, the fissures, the grooves, the ridges, everything has to be mimicked. Okay, coming to step 2 is the functional cusp reduction. All right, so functional cusp bevel with the round and tapered diamond has to be done, right? Has to be given, guys, yeah. The white bevel is placed on the functional cusp orientation groove, also helpful in the reduction, right? And functional cusp bevel is an integral part of the occlusal reduction. A failure to place the bevel will cause a thin casting or poor morphology. Fracture, right? So occlusal clearance, I think we have discussed before. We can just take a utility wax and just see if it's perforated, that means less clearance is there. If there's no perforation, that means perforation is there. Okay. Occlusal reduction, guys. So yeah, buccal and lingual walls are reduced with the round and tapered diamond. The sides of the diamond will produce the desired axial reduction, while the tip forms the chamfer. Okay. So yeah, something like that, guys. Yeah, you can see. Yeah, here. The facial reduction is going on, guys. Yeah. So the ledge is still remaining the because we are going to break the contact later. So yeah, sorry. Proof can be given. Sorry, guys. Okay. Yeah, if required for more retention, guys. Okay. But anyway, you have to do the facial axial reduction as well, right? There. And then you have to smoothen surface, right? So you can use the yellow band finishing burrs to smoothen all the surfaces. That's basically how it should look like, guys, right? There. And you can see the beveling, you can see the occlusal anatomy, you can see everything, guys, right? The margin is fairly equigingival there, guys. Okay. All right, guys, and this is a bibliography. It'll stay the same. Rosenstiel and Schillenberg, guys, right? Um, are the books standard textbooks for FPD, so you can refer to them. And for any further questions, you can come and see me. Thank you.